we are going to have two speakers who will be sharing some important information about asbestos. Asbestos, we will see the problems with asbestos. So the first speaker is a local speaker, and she will talk about some aspects of asbestos problem in Kenya. And then the following speaker, who will also talk about the same topic, will talk about follow-up of problems, what others have done regarding asbestos. This is one thing which we strive to do very much in OSH, as I mentioned in the beginning, that we have problems which other people also have same problems or have had such problems, and we will try to see what knowledge can we gain from others' experience so that we can be better also. So the first speaker is Miss Gladys Nyaga, who is health, safety, and environment and social safeguards consultant. She will present about to us about asbestos, the lurking danger. Miss Nyaga, whenever you are ready, please.
Okay, good morning, everyone. I hope I'm clear. So thank you so much, Abdul Karim, for giving me the opportunity to come and share on asbestos, the lurking danger. And the reason why we are saying it's lurking is because sometimes, or most of the time, people are exposed without knowing. So without much further ado, I'll just go straight to the slides. And any question, any comment is welcome. Let's share as I do the presentation. And definitely let's see where we are in Kenya in terms of asbestos and preventing the exposure. So the objectives, we start with the introduction, definition and classification, asbestos characteristics, occupational where asbestos exposure can occur, statistics, we'll check on the global statistics and maybe a few countries. Then asbestos route of entry into the body, disease caused by asbestos exposure, national and international laws on asbestos, legal compliance, that is in Kenya. Then Kenya asbestos disposal procedure, handling of asbestos, licensing challenges, and the recommendation. Next slide. Okay, so with the introduction, we know asbestos has been used way, not even in the 20th century, it has been used since a long time ago. So most of the, initially when asbestos was discovered, it has very good characteristics. We are going to see about them. And that's why it became so popular in history. Even when you check in the history on from Egypt, yeah, they used to use the asbestos to wrap the pharaohs. So it had a very variety of use. So as you can see in the pictures, you can see there we have firefighters there, and then we have the baby warmers for the milk. This was in the United States. And the other products that asbestos were used, we had the wicks for the lamps, the tiles, we have the roofing. That's the roofing. Now we are talking about abutment in Kenya. Yeah, next slide. Yeah, so sorry, definition and classification. So we know asbestos, they are classified into two major groups. That is the serpentine and the amphibole. So the serpentine, that's what we have currently in Kenya, that the roofing were widely of chrysotile type of asbestos. Then the amphiboles, we have 5 groups under that, but they are not widely used. And people will say that maybe serpentine is a bit safe because of the curly nature of the fibers. But we all know that regardless of that asbestos, it's dangerous, whether it's the serpentine or the amphibole. But you'll find most people saying that if serpentine is well controlled, then it's not as dangerous as the amphibole group. But let's take note that any type of asbestos is dangerous and it's hazardous to health. Next slide. Okay, so these are the characteristics that made asbestos very popular worldwide before the health impacts were known, and now people are facing out asbestos, and in some countries it's controlled. So the properties is the high tensile strength, chemical stability, thermal stability, high flexibility, low electrical conductivity, a large surface area. So there are various uses of asbestos. We have like the roofing product that was used in Kenya, the gasket and the brake linings. Also, that one we have because actually the companies that deal with logistics, maybe we can hear maybe from the people who are attending, like if they recognize asbestos in their workshops and what they do to prevent the exposure of the workers. And also, yeah, next slide we'll see more uses of asbestos or where people can be exposed. So mining and milling, that is in the quarries where asbestos is mined. And this we will see South Africa used to mine, but now they no longer do the mining. So we have mining, then manufacture of materials or products containing asbestos, use of application of asbestos containing products, stripping, repair, or maintenance of products containing asbestos. Currently, this is what is happening in Kenya because people, companies, government institutions are facing out. So we have a lot of abatement that is going on, and we really need to ensure that we do it the right way. We are going to see later on the laws and the regulations. Then demolition of plants or structures containing asbestos materials. Then transportation, storage, handling of asbestos. So that is in when it comes to the disposal of the waste. Then other operation involving a risk of exposure to airborne asbestos. So I'd like also to add that currently also cosmetic products contain asbestos, and there's a lawsuit that is going on in the US where there was a lawsuit on Johnson and Johnson, where the talc powder was contaminated with asbestos, and there was lawsuit on the asbestos causing ovarian cancer. So we are going to see that as we move on with the other slides. Next. So here is just to share on the statistics currently on asbestos. So according to World Health Organization, 1.125 million people in the world are exposed to asbestos at the workplace. So it's also very important to know that we have different areas that asbestos, people can be exposed to asbestos. We have the workplace. I've talked of the cosmetic products, and also within in Kenya context, within the estates, we find that asbestos are being disposed indiscriminately. We have kids who are there. So exposure can be, yes, workplace, but we also have different areas apart from the workplaces where people can be exposed to asbestos. So according to OSHA, 90,000 people die from asbestos-related diseases globally each year. Then according to the European Economic and Social Committee, exposure to asbestos claim about 88,000 lives in Europe annually. And then according to UK Asbestos Training Association, there are 236 mesothelioma deaths in 2019, and it is estimated that there were in addition a similar number of deaths due to asbestos-related lung cancer and 490 asbestosis deaths in 2019 due to past exposures to asbestos. So that totals to above 5,000 deaths. So in Kenya, unfortunately, I was not able to get any statistics on that, and I think the data is very important so that it can inform policymakers and those who are mandated with taking decisions if you have the right information. So asbestos route entry to the body, I'm not going to dwell much on this because the next speaker will be dwelling on this, but the most important thing I will let everyone know from here is that the reason why we are saying lacking danger is because if you are exposed to asbestos, they are microscopic, and you may not be able to know that you are exposed to asbestos because it's not something that you're going to have a reaction immediately. Yeah, and then also we have the asbestos containing materials. So it may not be 100% asbestos on a product, but it may contain asbestos. Next slide. So diseases caused by asbestos. So let's just look at some of the symptoms. So there's shortness of breath, chest pain, cough, fluid buildup, difficulty in swallowing, and fatigue. Next slide. Yeah, so diseases caused by asbestos exposure, we have mesothelioma, asbestosis, lung cancer, ovary cancer, larynx cancer, trachea, bronchus cancer. So once the asbestos find their way into the body is not able to remove all the asbestos from the body, and some you'll find they are embedding themselves into maybe the lining of the lungs, and that's where the scarring takes place, and also the plaguing. So the next speaker will be able to really go deeper into that and explain. Next slide. So international laws on asbestos, we have ILO conventions, which unfortunately Kenya is yet to ratify. I don't know why, but yeah, as you check, it's from 1986. We are in 2021, so that's quite a lot of time. Then we have the UNEP Basel Convention. Kenya has ratified this, but this only talks about the hazardous waste and how it can be controlled. Then we have European Union. There's a directive protecting the workers. So 2009 148 EC of the European Parliament and of the Council of 30th November on the protection of workers from the risk related to exposure to asbestos at workplace as outlined in Article 8. So this one is protecting workers who are exposed to the asbestos. Mostly is during the abatement, where now countries are removing the asbestos containing materials, the roofing, the insulations. So this was meant to protect the workers, and the OEL, occupational exposure limit, is 0.1 fibers per centimeters cubed as an 8-hour weighted average. So 5 of the 6 types of the asbestos were banned in 1991, and there was a total ban in 2005. So it's very good, take note of the OEL so that we can compare and see in Kenya where we are at the moment in terms of the OEL. Next slide. So we still are on international laws on asbestos. So the UK, they have the control of asbestos regulations 2012. Then Canada, there's a prohibition of asbestos and products containing asbestos regulation, that was in 2018. Then in South Africa, where asbestos used to be mined in the past, there was the asbestos abatement regulations, that was in 2020. So if you check on the guidelines for asbestos that Kenya has, that is the authority, NEMA, developed the guidelines, yes. You will see they are mentioning South Africa as one of the asbestos producing countries, but it's important to note that South Africa is no longer mining asbestos. Then we have the United States, we have the toxic and hazardous substances, 1926, 1101 asbestos. So also very important to note the exposure limit, what they call the permissible exposure limit, In the US, it's 0.15 parts per cubic centimeter. So take note of that, and let's see later where Kenya we are. Next slide. Okay, so for legal compliance, as I said, asbestos, there are different areas where you can be exposed to. So mostly you find that NEMA is talking about the management of asbestos waste. And that's where we have the asbestos guidelines that NEMA developed. So those ones are just talking about how the process of removing, mostly it's the iron roofing, the asbestos roofing. So how is it supposed to be done? What procedure is supposed to be followed? The PPs that are supposed to be provided for the training. So that's where the asbestos guideline outline all the requirements. We have MCA 1999. So in section 88, it states that any person intending to transport waste within Kenya, to operate a waste disposal site or plant, or to generate hazardous waste, shall, prior to transporting the waste, commencing with the operation of a waste disposal site or plant, or generating hazardous waste, as the case may be, apply to the authority in writing for the grant of an appropriate license. So the penalty for disregarding this is 1 million shillings. So we have the legal notice 101, the environmental impact audit regulation 2003, established under MCA 1999. So you will find that for anybody that is willing to undertake the business of waste disposal, whether it's the site or the transportation, they have to adhere to the requirements that have been put across by NEMA. Next slide. So legal notice 31 of the EIA, that is number 8 of 1999. The second schedule was amended, and that's put asbestos removal and disposal is listed as projects that have to be subjected to an EIA process. Yeah, and are classified as medium risk projects as outlined in section 10, waste disposal including C, removal and on-site disposal of asbestos. So environmental impact assessment audit amendment regulations also, you will find that every proponent undertaking a project specified in the second schedule, where now we have it defines the waste disposal for the asbestos and also the disposal sites. So in the second schedule of the Act, has been a low-risk project or medium-risk project shall submit to the authority a summary project report of the likely environmental effect of the project. So we will see one case whereby if the guidelines are not adhered to, you find that there's a lot of asbestos disturbance, because if a company is given the task of doing the abatement process, and they end up messing up and depositing where maybe the disposal site, there were issues with the EIA, you'll find that people are going to court, and you find that no, the person who had deposited that is being told, no, you have to remove the asbestos again. And with asbestos, we want to ensure that there is very, very minimal disturbance. So to avoid all this that people are taking to court, you have now to go again, remove the asbestos that was buried. So we have to just ensure that we adhere to the legal requirements that have been provided, so that we just ensure that the public is protected, and also to repeat redoing of the work. So next slide. So we have the waste management regulation that classifies asbestos as hazardous waste. Maybe it's good after this, maybe you can take up the task and read the regulations, because they are quite detailed. But just to the importance of this is to note that asbestos is just one of the waste that has been classified as hazardous waste. Next slide. So we have the national guidelines on safe management and disposal of asbestos. I've talked about that. So maybe you can have a look at it, but it states clearly what should be done. It talks about the EIA. It talks about the wrapping of the asbestos. How should they be stored? If it's temporary storage, for how long? If it's the asbestos site, what should be considered? We will see an example of where an asbestos site had to be closed because they contravened the requirements. So apart from the disposal, which is I think well taken care of with the regulations from NEMA, we also have the occupational exposure, and that's where OSHA 2007 comes in. So in the second schedule, we have a listing of mesothelioma. We are going to see, the next speaker is going to talk into details about that. So it's listed as one of the occupational diseases. Next slide. Yeah, so people are saying that, or maybe information is out there that asbestos has been banned in Kenya, but have we really banned it? And do we have a document saying that asbestos can no longer be used in Kenya, that it's a total ban, or is it a controlled ban? So I was not able to come across any document apart from the asbestos guidelines issued by NEMA, but I was not able to come across any document that categorically says that asbestos has been banned in Kenya, that you cannot use it, or if you're found using asbestos, then it's illegal in Kenya. So we have the factories and other places of work selling those solutions. So these are just examples I'm giving to just highlight that we still have asbestos laws that still have asbestos, like it's legally, like you actually they are saying, if you check like the cellulose solution, they are saying that except for cellulose stores, wood completely and securely covered on both sides with compressed asbestos of not less than 3/16 of an inch in thickness. So within the law, it's okay that a product can be made of asbestos. Yeah. Then if you check on the factories and other places of work, hazardous substances, you can see that our OEL are still very high. At the moment, if you check the UK and the US, they're talking of 0.1. Now you can compare that with, you can compare the 0.1 with what we have here in Kenya. And if you check on the OEL, that was back in 1995. So it's always good to ensure that, as we are told, like it's good you keep reviewing the regulations, because there's change in technology, more research is being done, and maybe more information is coming up. Next slide. Okay, medical examination rules. So here it states that if someone is exposed to asbestos, is handled including, they have to undertake clinical examination, lung function test, full-size chest x-rays, sputum cytology, then pre-examination and annual for all. And then it's also required to report to the director any symptomatic worker progressive deterioration in chest x-ray findings and suspected or diagnosed cases of asbestosis or mesothelioma or bronchogenic carcinoma. So I think we are lagging behind in Kenya in terms of data. I don't know where we can get this data, because you can imagine those roofing back then. It's people who did the roofing, but do we have those people now? Can we go back in terms of research and see where they are now? Like if it's mesothelioma or any other form of cancer, have they developed it now? So the research in Kenya, I don't know where we are in terms of asbestos exposure, but it would be good if we have that data, so that we can really tell people, or maybe the people now who are currently affected, they can tell us that I was exposed to asbestos back then. And this even includes even the mechanics, especially the ones who are working with the brake linings. So I think that is an area that needs to be researched, and we also need that data so that people can see the seriousness of asbestos exposure. Next slide. So again, here we have the KEB standards. So these standards are still valid. Yeah, they've not, how do I say it? Yeah, they are still valid. So you can go to KEB's website and you just type and you will see that we still have these standards there and they are valid. So that's why I'm saying when we say that asbestos has been banned in Kenya. So is it really banned in Kenya? Like, can you prevent somebody from using asbestos or manufacturing or some products or importing products that contain asbestos? So I think I'm saying that there's more research that needs to be done on asbestos exposure. Next slide. So the challenges, actually, this picture is what prompted me to do an article. I did an article in LinkedIn about asbestos and the lurking danger, because I went to the field and found that there are some asbestos that were not disposed as it was supposed to be, and the asbestos found their way into the community. And this community have no idea what asbestos is and what it can do to them. So I found it very irresponsible for somebody to just remove roofings, maybe it was in a factory or government institutions, and just dump them somewhere where the public can access. And as you can see here, this is not a well-off community. So somebody will think that those are free iron sheets, those are free roofing sheets that I can just take and use them in my home. But they really don't understand the lurking danger. And that's the reason why we are saying the lurking danger is when you handle asbestos, there's a tendency of them being broken down, or when maybe you're hammering, you want to get them on the wood, the disturbance now takes place there. And then you find that the dust that is generated, somebody is going to inhale. And something else that is of important to note is the latency period from exposure to when you now develop the symptoms. It takes like 30 years. So you find children who are being exposed to this asbestos, maybe they are stored in the homestead there, you are sweeping the every morning, you're sweeping where the asbestos are, you're exposing the children to that, the people are not aware. So really it's a lurking danger, and there's need to ensure that the asbestos are well disposed. I don't know what the government is going to do about the asbestos that are already finding their way back into the community. I really don't know what's going to be done, because there's a lot of complaint. There was complaints in Umoja and Kitengela. So just go back, Abdul Karim, sorry. Yeah, so the challenges, we have the cost implication and a lot of paperwork, then unscrupulous disposal in open dump sites, then disposed asbestos in open fields, finding their way back into the community, then lack of public awareness on asbestos as a health hazard. Next slide. So the other challenges is inadequate EIA process. As Dr. Muluka talked about public participation, that is one of the things that is required in an EIA process. And if it's found out that there was no public participation, then you may find that the license can be revoked. So as you can see here, there was an issue in 2017 where the asbestos were not disposed in the right way in Kitui County. And you can see the governor there, Charity Ngilu. They were protesting on how the asbestos was indiscriminately dumped. It was in a water catchment area. So so it's very important to adhere to the EIA guidelines. Then failure by licensed transporters and disposal sites to adhere to the EIA license requirements. Next slide. So recommendations, review legislation to reduce the OEL to 0.1. 0.1 is what most companies are currently adhering to at the moment, and you've seen in Kenya we are a bit high in terms of the OEL. So we can a total ban on asbestos containing products, including brake pads in the clutches and the linings. Then commitment by stakeholders to adhere to legal requirements. So apart from the legal aspect, you have moral and ethical. Just do the right thing, not because you're being forced by somebody, but because it's the right thing. So that is the moral aspect. Next slide. Yeah, public awareness. It's good because people out here do not know what asbestos is. They do not know the dangers of what asbestos can cause to their health. And then the other disadvantage is the long latency period. So if maybe you are not exposed in an occupation or in a workplace, you may start wondering, where maybe did I get this disease from? But if research is being done or investigation, maybe they will go back and see they were exposed to asbestos. Then enforcement of the law for the violators by the concerned authority, then prompt follow-up by NEMA of complaints from members of the public. So I think that marks the end of my presentation. Abdul, you can go to the next slide. Yes, so that's the end of my presentation, and let's hear now from the attendees. If you have any question, yeah, any clarification, then yeah, thank you.
Well, thank you very much, Gladys, for that wonderful presentation on asbestos and the challenges with asbestos. It's a serious issue that we need to address again and again and again, and in order to be able to get solutions to this. But before we go to the questions and comments, I would like to go straight to the next presentation by Dr. Erik Danelsen, because it's more a continuation of the presentation from Gladys, where Dr. Danelsen will talk about what has been done in other places, like in Norway. What have they done to actually face and try to eradicate the problem with asbestos? So I will ask Dr. Danielsen to share his presentation, and I give you the word.
Thank you very much, Abdul Karim. Could you please give me the opportunity to share my presentation, my slides?
Yes, you can do that. You can just share.
It's not. I'm not a
Okay.
I'm not the right authorities, so the picture where I can share is not open.
Okay. Just
you
a
have
second.
to help me to give me the right. Sorry, people. We are a bit late, but and you haven't had a lot of breaks, so I hope you are not too tired to hear a little bit more about asbestos. When Abdul Karim is making this possible to me to share the slides, I would like to thank very much to Dr. Nyaga for this excellent presentation she gave. It makes my work rather easy.
You can give your presentation now. You can share your presentation now.
Okay, it's not possible because you haven't given me authorized me as a co.
Okay, Imran, can you make Dr. Danielsen?
Now it's okay. Thank you.
There you go.
It happened now, so that's. Now you probably will see something. Can you see my presentation now?
Not yet. If you share a window, or
I share window, and I share the presentation in my window, and then now I'm sharing. Can you see it now?
Not yet.
I think we have to be a bit patient. You cannot see anything?
No. Not from my side, at least.
Because I can, for me, it seems like my screen is visible for others.
Can everybody else see the Dr. Danielsen's presentation? Can we get some more feedback on the chat, maybe? I can, no.
But then I suggest I sent the presentation to you in beforehand, because I can, it works here, and it seems like it's visible. Your screen is visible for others, but maybe it's
Okay, it seems almost can you try to share your screen and see if it works.
okay. Then I stop there. And can you see it now?
No, it's not. Can you send this presentation to me right now?
You have it already.
Yes, I have.
I sent it to you early this week.
Yes, true.
In case this problem happened, then I did it in beforehand. But so
just a second. I remember I had opened the PDF and not the PowerPoint. So if you can send me the PowerPoint now, I can fix it right away. I see I downloaded the PDF only.
okay.
Sorry, folks. This will take only 2 minutes, and we should have it on. And we did a test that went very well.
I do not think people believe that it went very well when you see all the problems now. But
it went actually very, very well without any hitches. But yeah, technology.
So what happens now on my PC is that it's downloading my presentation. It takes some time.
No problem. We'll make some few adjustments, and it will be fine.
But maybe you should open the PDF.
I can do that. It's just as good, and then you can tell me when to move on.
So people, sorry about that.
Okay, I share the PDF.
PDF, thank you.
Yeah, and
so, but I'm just I want to congratulate you with this event, then that it's possible also to share understanding cross-border, because I'm sitting at home in my study in Norway. It's -5 degrees outside. It's a very wintry conditions, and it's very interesting to be able to communicate. We have some problems. The same problems could also occur if you had done it in Norway. But let's move on to what is going on. And the key word for my presentation would be asbestos. it would be a process for regulatory work. I also have quite a few experiences with patients with asbestos illnesses. And the problem with asbestos illnesses is that it occurred maybe 30, 40, or 50 years after exposure. So remember what Dr. Samant told you about the hierarchy of prevention. What we do today can prevent diseases very long time after we prevent the disease. Next slide, please. So sorry to give you this work,
No problem.
Abdul.
There's no problem at all.
When you see the presentation from Dr. Nyaga, you see a major problem with asbestos, a major health problem. She calls it a lurking hazard. It's even more than a lurking. It's a very relevant hazard for a lot of workers, and it's 10,000s of workers exposed today. So it's very curious that we do not that it's not been able to make a global ban of real asbestos use. When I talk about real ban, I mean about using asbestos in new installations and new buildings. We also have the problem with mining. We also have the problem with rehabilitation of old buildings, and that's what I'm going to talk about from Norway. Because we had a ban in Norway from the 1980s, but still there are a lot of asbestos remaining both in building and installation and in the environment. Next slide, please. And just to follow up, our OAL is 0.1, the same as the international standard. 0.1 milligram per cubic centimeters in 8 hours weighed average. So, but what has lately happened on asbestos? We had a ban nearly 40 years ago, but still it's a problem in our society. So with all the countries using asbestos today, they will also have problems for many decades after they regulate with bans. So the example I can give you is that we had a report from the Labor Inspectorate in Norway about the status of follow-up of asbestos. It was published in January last year. We have a project report from STAMI, that's the same as the National Institute of Occupational Health, about the exposure in asbestos removal, because that's a concern. We call it the third wave of asbestos exposure. You have the mining, you have the use of it, and then you have the removal. And then we had also a close-knit working group with different professionals giving recommendations for follow-up of workers previously exposed to asbestos. And then we have also, after all this, a new this month proposal for changing regulatory follow-up. Next slide, please. I hope you can follow. So first, the report from the Labor Inspectorate. What could we do to make sure that asbestos is not lurking, but it's recognized and clear cut where it is? We in this report we suggested different measures. One was a mapping of already used asbestos, the training in asbestos removal work, different kind of workplace visits from the authorities to look what happened regarding asbestos removal, and then also what I've already told you, giving regulatory changes. Next slide. I'm sorry, the report is in Norwegian, so it's not very easy to distribute internationally. So, given the situation, do we have a new situation after 40 years with ban? It could, 40 years ago, it was a lot of workers that had recently been exposed to high levels. Now it should, those should be, pensioners and out of the work life. And the people working with removal should now be very well protected in their work. But we also know that some workers work in old buildings and installation without knowing that they work with asbestos and could be exposed in significant degrees. So it's less use in regular work life, but there are still asbestos there, and still lung cancer and mesotheliomas among exposed workers. And that's to remind you, what you do today is give prevention many years ahead. So most of the patients I saw with, for instance, asbestos-related lung cancer or mesothelioma had been exposed in the 60s and 70s when asbestos was in regular use. Next slide, please. Now we move on to the STAMI report from June 2021. This year, during the pandemic, it was presented in a lot of seminars in the country, and it clearly demonstrated that removal work gives some potential for exposure. So that's what you see, and to not use too much time. These slides will be distributed after the presentation, so you can look more in details afterwards. But you see that if you take out asbestos, there are asbestos in the air. It's above the exposure, the limits values, which means that the workers have to be well protected. So you need to use PPEs, and the PPEs should be of a kind that gives perfect protection. Next slide, please. So, and then you have the third initiative, the recommendations from a working group led by STAMI, the National Institute. And that was a very interesting work because it was professionals from several professional disciplines within the medical and occupational hygienists. We tried to establish a broad understanding of the problem. We had meetings over several years, and it's very, I think it's very relevant for occupational medicine to cooperate. You will of course agree, but it's very relevant to cooperate with specialists in occupational pulmonary medicine, oncology, radiology, and occupational medicine and occupational hygiene to give a full understanding. And this work was also in the trade unions and the employees' organization were also involved in the work. Next slide, please. So the conclusions, and it's many words in a slide, so you can look at it in detail afterwards. What imaging method is recommended for screening asbestos exposed? And then we say that prior to work, maybe you should take an X-ray examination to exclude workers with already asbestos-related findings or other lung diseases that could be of danger going into asbestos removal. And if you want to follow up during work, when you are working with asbestos removal, that's the main thing, is to avoid any exposure. But if you cannot avoid any exposure, so now we have a different picture, Abdul Qadir. If you don't have any exposure, then it's important to follow up that the lung function due to other lung-related diseases are not limiting the ability to do the work. So we discuss use of spirometry. Dr. Nyaga has mentioned it a lot earlier, but spirometry and also maybe the high-resolution CT to see if you have other diseases that could influence your ability to do the work the right way. Next slide, please. So it has also been a discussion due to some new scientific findings that primarily those that are heavy smokers could benefit from a screening program to be able to detect lung cancer very early. so that it could be treated and not be a fatal disease. So based on those findings in those recent big projects, we have discussed that maybe asbestos exposure and other kind of occupational exposure should be a part of the risk calculator together with smoking habits to give the right follow-up to the right people in the society. So it could prevent some fatalities of lung cancer, and if they should be followed up, then computer tomography would be the right thing to do, but with reservation, because screening should not influence the health of the people, because if you should do screening, you have to do it very, very often, because lung cancer could develop very fast from a very early stage to an inoperable stage. So that's why we suggested that, because it's not known in the international studies that they also use occupational exposure. Some studies has asked the participants if they have been asbestos exposed or not, but there are no kind of exposure assessment, and I think it's also other exposure that could be involved in a risk calculator like that. So it's an ongoing work now with experts in the National Institute to make such a risk calculator, so we can be able in Norwegian studies to also follow up occupational exposure. Next slide, please. And then we have looked at the regulatory changes on medical surveillance, and that I've also told you what is going on, because the way we have had medical surveillance has been quite unchanged since the early days, since the ban in Norway of new use of asbestos. And now we maybe have to look at different health aspects, and I see that there is it's the start of an ongoing discussion in Norway between experts to look into how modern principles could be used to have a very efficient follow-up of prior asbestos exposed workers. So, but you have one kind is to exclude diseases that may prevent workers from being put to work, excludes illnesses that occur during work. It could be asbestos cleaners, it would be asbestos removers, and it could also be other diseases than those that has been due to asbestos exposure. And also it could be medical surveillance should be between an expert occupational physician to investigate symptoms of asbestos diseases. I talked with colleagues in the mid-Norway yesterday, and they told me for the first time in many years they had some suspected asbestosis cases. When I asked them when they thought the workers had been exposed, they told me that the exposure was probably before the ban. That means that they have gone with some asbestos-related illnesses for 35 years undiagnosed. Next slide, please. So the new proposal would be that in Norway it's the employer that has the responsibility to do the work in a good matter. So the employer should then ensure that employees that may be exposed or have been exposed to dust with asbestos, they undergo a suitable health examination. And that's what are discussed now. What is a suitable discussion? And then you have the involvement of the employees and employers and their organizations. So it's the regulatory process, like in Kenya, could take many months or even many years. But the process is now ongoing in our country. So the health examination must be performed before they are put to work to avoid that that workers that are should not do this work due to prior disease should be excluded from this work. And then when the workers have been exposed, they should be regularly followed up to avoid lung disease or other diseases that make them unable to use the right equipment, and also to discuss their experiences with the work. And when workers have symptoms during work, they should also discuss it with a competent doctor with special competence in occupational medicine, and also with relevant competence on what kind of work the worker is doing. Next slide, please. So the time between the tests should be no more than 3 years. And if the doctor thinks it's necessary to do it more often of different reasons, because there have been some developments, it could be of 1 year or shorter time. So this is not the same as the screening program. But at the end, when the employment is over, and if the competent doctor means that thinks that the worker has been heavily exposed, they should be also followed up after pension or after quitting work. And why do you think so? That is of course because this has a long latency period for different diseases. I mentioned the case that I heard about yesterday of asbestosis. Then you have lung cancer, and then you have mesothelioma. And it's also concluded that expenses for the health examination that are not covered by the Social Security should be paid by the employer. Next slide, please. So I try to be quick, Abdul Kadir, to take up time. I think the people soon would like a lunch break. But I know that there will be a question, time for questions now, but I give you also my email address and invite you to send me an email if you have questions about this, if you think I can hand over some of the reports we have done, if there are any experiences there that could be interesting for you. I'm sorry that some of it is in Norwegian, but if there are any English summary or relevant summaries available, I will be glad to distribute to you. So without any further hesitance, I would hand the word back to the leadership of the meeting, and thank you for helping me with showing the slides. Thank you very much.
It was very little. Thank you, Dr. Danielsen, for this presentation about follow-up on asbestos problem. You see similarities of problems irrespective of the country. When it comes to asbestos, if it's in Norway or in Kenya or wherever it may be, we have similar problems, and the follow-ups would be necessary in different aspects. So we'll open for questions and comments to both the speakers, Gladys and to Erik. You can write your questions, or if you wish to speak, you can raise your hand. We already have 2 questions. The first one is, I think, is to you, or Gladys. That is, asbestos is still widely used in Kenya, especially for roofing. So do we have like specific regulation to guide or to provide when disposal should be done? That's the first question. So this is we have the roofings. When should they be removed? Is there a time limit on how long they can stay there before removing?
Okay, thank you so much for the question. But at the moment, there is no any time limit. And actually, the guidelines, the national guidelines on safe management and disposal of asbestos, they were meant to give a guideline to any institution or any individual who would like to remove or maybe undertake the abatement process. But at the moment, there is nobody who is going like to be forced to remove the asbestos roofing, because mostly that is what the guidelines were meant for. But there's no coercion or there's no time limit on when the roofing should be done. It's on a voluntary basis. But what NEMA officers does is to like maybe go to a factory and discuss on the effects of the asbestos roofing, or if they are deteriorated, they can give them maybe an improvement order or advise them to remove. And you'll actually find most institutions, they do them not at a go. They don't remove all of it, they do it in stages. I hope I've answered that question.
Thank you very much. The next question is, what are some of protective measures against exposure to asbestos when handling asbestos or products that contain asbestos?
Okay, so for handling the products, currently the abatement process, the removing of the roofing, that is well taken care of in the national guidelines on safe management and disposal of asbestos. So you will find that they are specific on the PPEs that should be used, the training, the risk assessment, and other requirements is like undertaking the hydrogeological report, the signages that should be there. So with the national guidelines, that's where you will find the control measures that should be undertaken when it comes to the abatement process. But in terms of maybe the manufacturing, as we've seen, the CAP standard, that one I'm not in a position to maybe refer to a document on how that should be done.
Okay.
Could I give a comment to Alex?
Yes, please.
So because what we do is to restrict the working area, so you do not get any environmental spill, and then the worker should then go in and out of the area where asbestos work is going on with full equipped with the body equipment and also respiratory equipment that should be tested very well, because this is a disease that goes through the respiratory system. So to avoid exposure there is also of most importance. And then we also have very strong regulations to make sure that when you have finished the work, there are no asbestos remaining. Also with this thinking about this environmental spilling. So and if you give the worker the wrong respiratory protection, then it could go very, very bad, because if they are not protected, they could have high exposure that give obvious risk for disease. And most people that have worked with asbestos, they say it's very easy to work with asbestos. It gives not very much symptoms, and that's part of the lurking problem. Because you get the asbestos in the lungs and it gives health effects long after exposure. So it's very important to read about it and do this the right way. Thank you.
Thank you for that input.
Okay, Abdul, maybe to add on that, actually the guidelines are very clear on the PPEs, the respirators, that is half-face dual cartridge respirators with HEPA filters. Then we have the additional PPEs and other control measures that should be adhered to.
Okay, thank you for that addition. We have a new question to you again, Gladys. Should NEMA enforce the removal of asbestos roofing from all houses? Let's take this as a last question, and if there are any additional questions, we can send them to the speakers, because we are a little bit behind time and we want to move to the next item. So, should NEMA enforce the removal of asbestos roofing from all the houses?
Okay, the removal of the asbestos roofing, it's quite expensive, and at the moment it's voluntary, and actually you can do the process in phases. Enforcement, It can be done, but it requires a law, which maybe will give a time limit, like the way they did with the polythene bags. But there's a lot, because we talked about consultation with the various stakeholders. So it's not something that NEMA can just come and say now they are giving a timeline for the asbestos to be removed. It's a consultative process. Maybe we'll get there, but at the moment it's voluntary.
Okay, so it's not enforceable yet. So as I mentioned, we're slightly behind time. So I will take this opportunity to thank both speakers, Gladys Nyaga and Dr. Erik Danielsen, for the wonderful presentation on asbestos. I suppose now we know a little bit more about asbestos than we did before we started this conference. And this asbestos, we see it has a long latency period, so people exposed today will take 30 years maybe or more before they are detected. So as long as we, yes.
I just wanted to congratulate you with the event and wish you all very much luck with your important work. Remember, this is very important, and the awareness about asbestos is very important, and you the workers you work with will benefit for decades coming. So thank you for using time on asbestos today. Thank you.
Thank you very much for those kind words. And their topic is not exhausted. Maybe in our further discussions in